The British government is ruling out another COVID-19 lockdown this winter, but medical professionals are warning some restrictions may need to be put back in place. Officials with the National Health Service Confederation say mandatory face coverings in crowded and enclosed spaces should be reimposed. Cases and hospitalizations have been rising sharply across the UK, but the government says further lockdowns would jeopardize the hard-won gains of reopening the economy. The UK has the highest number of COVID-19 infections in Europe. And with me now is Dr. Stephen Griffin. He's a virologist at the University of Leeds. Doctor, good morning. Glad you could be with us.
Good morning, Marcia.
So explain what we're seeing happening across the UK. Is this a story of waning immunity? I'll remind our viewers that the UK had a very successful vaccination program early in the fight against the virus.
I think there is a partial element of that, Marcia, yes. But I think the major problem is driven by the fact that we have very, very high prevalence of the virus in the UK at the moment, and have done since we essentially relaxed all restrictions over the summer. And last week we had a parliamentary committee report in the UK that criticised the government for leaving their actions too long and too late until things got so badly out of hand that we had to impose more severe restrictions. And I'm quite concerned that we may see that happening again this year.
You're concerned that there will be more restrictions brought back?
I think it will come to a point when that has to happen, I'm afraid. I mean, the lesson that we seem to be failing to learn endlessly is that with a disease like this, you need to act quickly and preemptively, rather than just watching and waiting until things get so bad that the NHS is overrun and fatalities start to increase again. We're seeing a huge number of infections, particularly in our younger populations. There's associated hospitalizations. It's spreading through into more vulnerable communities as well. And this really compounds the issue of having that reduction in protection from infection that we see from some of the vaccine responses waning.
Right, and I know one British scientist said the rate of infections among secondary school-age children is really a driving force behind this new tide of infections. So what do you think you're looking at in terms of restrictions coming back into place? Will it just be in schools? Will it be broader than that?
Well, I think it all needs to be hung around the vaccines, but the vaccines should not be used in isolation. So we, in the UK, delayed a decision to vaccinate teenagers compared with the rest of Europe. And that really has set us behind and has been a fundamental driver of the number of infections that we've had in our school-age children. And as well, we're only giving them a single inoculation at the moment, which we know is nowhere near efficient enough to prevent infection. So that will help. But really, schools have been allowed back with very few controls on infection in terms of having students having to isolate or wearing masks or taking other procedures. Ventilation has not been improved. So it really is a shame that we've allowed this to occur. It's having a huge impact on young people's health, including long COVID symptoms in the young as well. So that then is fueling this really quite significant increase in cases that we've been seeing progressively since summer, really. It's just getting worse and worse.
And what's the government's position on booster shots, Doctor?
Well, the boosters, again, are seen as the strategy to counteract this, and that's absolutely fair. You know, we think that these vaccines probably will work better with a third dose, but when you consider that the rest of the planet hasn't, you know, in great proportions not had access to a single dose, then actually you have to think about the longer term picture here. The reason that we need boosters is because of high prevalence. The reason that clinically vulnerable people and older people are again vulnerable to this virus is because of high prevalence. And the reason we're seeing this high prevalence is because we've relaxed restrictions. So it's a question of, do you impose moderate restrictions early to avoid more lengthy and robust restrictions later on? And we've been through already 3 lockdowns in the UK. I desperately hope that we will act soon enough to avoid another one.
Doctor, thank you so much. Dr. Stephen Griffin is a virologist at the University of Leeds.